Coronary bypass surgery is bypassing the coronary arteries that are the blood vessels on the heart that supply blood flow to the heart muscle. And as you can see on this model, this red area here represents the heart muscle, which is the part of the heart that actually contracts to get blood flow out of the heart to the rest of the body. And in order for that muscle to work, it needs blood supply. And that blood supply comes from the coronary arteries. And there's actually three main vessels on the heart. The right coronary artery, which you can see right here, which goes between the right atrium and the right ventricle, and the left anterior descending artery, which runs between the left ventricle and the right ventricle, and the circumflex coronary artery, which is over here on the lateral side of the heart. Now, over time, these vessels can get narrowed, and there's a lot of risk factors. Family history is one of the biggest risk factors, and obviously you can't do anything about that. Hypertension is another risk factor, smoking, diabetes, and high cholesterol. Those are the big 5 risk factors. So it's very important as a primary line of therapy to actually control that as best you can, and you do that with your primary care physicians and your cardiologist. When these vessels get narrowed to a certain extent, usually over 50 to 60% narrowing, people can start developing symptoms. And those symptoms are usually either chest pain or angina, shortness of breath, and a small subset actually will present with sudden death as the first presentation. So once you have any of those symptoms, obviously you get worked up, usually come to the hospital. The cardiologists run a series of tests, and one of them is cardiac catheterization.